So just to remind everybody, we are recording today. So we will get going here just a second. So good morning and thank you for joining UNC Health for today's media briefing with UNC Health Hospital leaders. I'm Phil Bridges with UNC Health Communications. Today's 30-minute call will focus on how UNC Health hospitals are treating patients during this crisis, protecting staff, and preparing for more cases. Today's meeting is being recorded and the video will be posted on YouTube later today. And after introductions, we'll engage our speakers in a couple of questions and then open up the floor for questions because that's the whole reason we were having these. So please make sure to unmute yourself to be able to ask questions, and you can also send them via the chat function, but we really like to have you ask the questions directly. Please keep in mind, if our experts can't answer the questions, we can do a follow-up afterwards. And now my colleague, Alan Wolf, will introduce today's leaders. Alan?
Thanks, Phil. Janet, Ernie, thank you for joining us. Janet Hadar became president of UNC Hospitals last fall. She previously served as senior vice president of operations and has had a long career as a clinician and administrator. She began her career as a nurse and later as a practitioner. Ernie Bovio joined UNC Rex as chief operating officer after serving as CEO at High Point Regional in the Triad. As president of UNC Rex, he oversees the Raleigh Health System as well as the new community hospital under construction in Holly Springs. Janet, do you want to start and just give some introductory remarks?
Sure. Good morning, everyone. Thank you for joining us and thank you for allowing us this time to share with you and the broader community all of the activity that's going on in our medical centers. It's been an interesting time, to say the least. I've been in my role for 6 months and never anticipated having to lead through a pandemic. But we've got terrific leadership, an amazing workforce, and faculty, physicians, and I'm really delighted, and I look forward to sharing with you a lot of the good work that's being done.
Ernie, would you like to give some opening remarks too?
Oh yeah, I'm glad to spend some time with everyone this morning and be able to share what's going on in our hospitals. The planning and the preparation over the past 6 to 8 weeks has been intense, and our teams have really stepped up to prepare and respond to the crisis. And it's been impressive to watch our physicians and our staff become very flexible and adaptable in all the work that's being done. And they're prepared, we're prepared, and we're glad to share that with you today.
And before we turn over to media, just ask a couple questions. You recently had an op-ed, the two of you, that was published in a number of areas, including WRAL and News and Observer, where you were thanking the community. Why did you feel you needed to do that?
I have been experiencing continuous moments of gratitude. Our coworkers, our physicians, Ernie mentioned the amount of change and new policies and procedures. The pace at which we're doing this is unprecedented. So thankful for their commitment and dedication. And we also think about our patients and visitors that we're serving. We are asking them to do things that we never could have imagined in normal circumstances. And then the broader community has really stepped up. The donations of food, good wishes, monetary donations, the research community at the University of North Carolina, it's really been overwhelming, and it's difficult at the pace that we're moving to thank everyone individually. And so Ernie and I wanted to make sure that we paused and picked up our heads from the daily work and extend our gratitude to the community.
Yeah, I would just add that the community support has been tremendous. It's been overwhelming. We're constantly receiving letters. Our staff are receiving cards. Our physicians are receiving letters of encouragement. It's very inspiring to see the community step up and make donations of equipment and supplies and food, and it's really neat to see the community come together and support the healthcare workers.
Great. So we've got a number of folks from broadcast and print and online media. So we'll go ahead and start taking questions now. We don't have a very organized way of getting in, so please just unmute yourself, and hopefully everybody should be unmuted, and go ahead and start asking questions.
Hi, this is Sarah Kruger with WRAL, and I wanted to ask you all if you have had to furlough any staff members, and if so, which staff members and which departments and at what hospitals and why?
Yeah, y'all probably seen many of the reports across the state and the country where hospitals are having to lay off or furlough staff. We haven't had to do that yet, and we have no intention of doing that. Our volumes have dropped significantly, 40, 50, 60% in most of our patient care areas. So our staff have not had as much work to do. And with that volume drop, our revenue drops. And so it has a financial impact. But what our staff have been doing is many of them have been training to work in other areas where we may need their support if we do get an influx of critical care COVID patients. So they're going through training, they're working with different teams, they're oriented to different units. And Rex and UNC Health, we're in a strong financial position and are able to weather this maybe a little bit longer than some other hospital systems or independent hospitals. And we're committed to taking care of our staff and our coworkers, and we'll avoid at all costs the furlough or the layoffs. And we don't think we'll have to do that.
This is Rick Stradling from the News and Observer. For weeks now, you and other hospitals have been preparing for a surge in coronavirus patients. And now the talk in the community has turned to how to reopen businesses and the economy. From where you sit, has the surge arrived, or does it feel like it's something that's still coming? And do you think it's too soon, from your point of view, to be talking about what comes after the surge?
Yeah, we've looked at different models, and some had us peaking yesterday. We don't think we've peaked. We see this as a steady increase over the next few weeks. We're looking at a peak in mid to late May, and that's all dependent upon the social distancing restrictions, and if those are lifted after the end of this month, how they're lifted, what restrictions remain in place. So it's really hard to determine and predict what will happen. So just hard to say. There's so many different models out there that have peaks at different times in the next few weeks. We're prepared for it, but not sure when it's going to be here.
Yeah, and our approach has consistently been to be prepared in any scenario. And so if it's a slow and steady increase over the summer, we have ways to manage that. If there's a quick peak in June, we're prepared to manage that. And we're equally preparing to begin thinking about, when the time is right to reintroduce care that many in our community have delayed and are really needing. We can't forget about that. There's people out there who need care, and we can only delay that for so long. So a lot of preparations in all of these various scenarios.
Yeah, planning to introduce and phase in, hopefully soon, a safe way to bring those patients back that have postponed their care. And as long as we have capacity, we have supply and equipment, and we can do it in a safe way, we're starting the planning process for that now.
That's something that you can do while the surge is still happening?
Well, based upon the trends that we're seeing now, we can reintroduce patients into our system. Part of the restrictions and why we've delayed elective procedures and are only really performing urgent, emergent cases, we wanted to preserve capacity and make sure we were ready. We wanted to preserve the personal protective equipment and make sure that we have all the policy, process, protocol in place to take care of the COVID patients. We feel pretty comfortable with all that now. So we'll evaluate once social distancing restrictions are lifted. We'll work with Secretary of Human Health Services, Mandy Cohen. She will be advising and guiding that. We have a number of the medical associations that are already putting forth recommendations and criteria on when to introduce patients back into the system. So we feel confident that we can do that now if the trends that we're seeing now continue.
Does the use of virtual care or telemedicine, does that play into the ability to reintroduce patients for elective surgeries?
I believe it does. And, you know, sometimes you make the best out of a crisis, and the pace at which we adopted to virtual care and telehealth has really been, I think we've done that more quickly than we have many other initiatives over the years. And it's a great way to stay in touch with our patients and also alert us if someone is really not doing well and needs care sooner than we anticipated. We certainly are bringing them in and making sure that they're getting that care. But we've been using extensive use of virtual health and really appreciate a lot of the regulation around it that's been relaxed both by CMS and payers to allow us to be a bit more nimble.
Holden Kurwicki with CBS 17. A lot has been made about the number of beds available. Can you walk me through the process of how that's reported? Are those numbers reported daily by UNC hospitals?
Yeah, we're reporting to the state, to the county, to each other. And we've been able to increase our bed capacity because of some of the relaxation in the state CON laws, and Medicare has allowed us to identify other beds in our hospital that we can designate as inpatient beds. And just to give you an example, at Rex, we're licensed for 439 beds. We applied with the state very quickly. They turned it around in a day about 6 weeks ago, and now we have 768 licensed beds. So we've been able to increase our capacity in the hospital. We're licensed for 78 ICU beds. We've increased our ICU bed capacity to 230 ICU beds when needed. So we have a lot of capacity available in our facility now.
Yeah, and in Chapel Hill, our baseline, we're at 950 licenses, and we've gone through the same waiver process, and we have the ability to expand up to, I think it's 1,244 patients. So a lot of capacity right now within our four walls before even having to think about going outside the walls of the hospital.
And this is Sarah Kruger with WRAL again. I wanted to ask you all about testing, and specifically, do you all have enough tests right now, and how long does it take now to get the results back?
So at the medical center, we're very fortunate that Dr. Melissa Miller, back in late January, early February, she had been working on developing an in-house test and was able to get that approved through the FDA. So we have not had to rely much on any state or CDC testing because we've had the ability to control our own. Having said that, to do these tests, you need appropriate nasal swabs, reagents, and from time to time, the supply chain of getting those has varied. When the stream is coming in steady, we have no problem testing patients who need it. And typically we can get those results back within 24 hours. Now those are PCR tests. There's other forms now that are coming out. And so we're eager to have those validated because we need to make sure that our testing, the sensitivity and specificity of those tests, that they're accurate. And so once we go through these new testings and ensure that we're comfortable with the accuracy, we'll begin using those as well.
Since we're on testing, I have a couple of questions. I'm wondering if there is a testing regimen for workers. I saw Alan Wolf's statement yesterday, but I'm wondering whether there's randomized testing for workers who come in contact with COVID patients, since we know some people don't show symptoms. And secondly, I have a question about the percentage of false negatives that are showing up in the hospital testing. I'm wondering if you have a percentage of false negatives, and and what you do to make sure that people who are testing negative actually are negative.
I don't know the answer to the false negative question. Do you have a perspective on that, Janet?
No, I'm interested to see the source because I'm aware that we typically see false negative in asymptomatic patients, but in a symptomatic patient, our rates of false negative, I believe, are quite low. But it would be helpful to see your source to understand their perspective. Testing is I'm learning a lot about it, and we have to be careful the numbers that we throw out there. Really understanding the type of test that it is, serology, PCR. And I think it's also important to recognize the technique. It's very important that the individual performing the test uses proper technique, because sometimes that's the source. It's not the test itself, it's the technique.
Thank you. And could you answer the first part of that question about the testing regimen for employees and whether there is any randomized testing?
At the medical center right now, any individual that is symptomatic, any employee that shows any signs of symptoms, and this is something that's even evolved in the last 6 weeks, right? First, we were concerned about lower respiratory symptoms, coughing, fever. Then we extended that to upper respiratory symptoms such as sore throat and sneezing. And then it was extended to GI symptoms, nausea, vomiting, diarrhea. So we're at the point now where any employee who's concerned about those symptoms, they know to stay home. We have a very well-defined process in place with occupational health where they call. They don't come to the hospital if there's testing that's initiated. We bring them to one of our respiratory diagnostic centers that we have put up around the state to keep, to ensure timely testing for the community and our coworkers. So we're not, to answer your question specifically, we're not doing randomized tests. As I said earlier, the false negative rate in asymptomatic individuals might lead us to believe that we're in a position that we're really not. So we're waiting until someone does develop symptoms.
Holden Kerwicki with CBS 17 again. I've done a number of stories with Dr. Barrick over at the Gilling School of Public Health, and he's been hailing a drug called Remdesivir that is in clinical trials right now. Are you all, using that to treat COVID-19 or participating in any of those trials at this point?
Yeah, the researchers at the university have been eligible to participate in those clinical trials. So I don't believe they've launched yet. I can find out for sure, but we are one of the few sites in the country that will be participating in those trials.
Could you address something we haven't really talked a whole lot about, that UNC Health has had a system approach to this? It's not just been the medical center in Chapel Hill and not just Rex and not the other hospitals in the system. What has that been like, and how has that worked?
Well, we quickly formulated a response team to the COVID crisis and developed what we're calling a COVID leadership team, senior executives and physician leaders to oversee the response and the preparation and the planning. We have a Triangle Command Center, which both Janet and I, other physician leaders, clinical leaders are a part of the Triangle Command Center. All of the hospitals within the Triangle are reporting up through the Triangle Command Center. And then we have a statewide command center that's set up for our affiliate hospitals throughout the state. And so the coordination effort has been great. We have membership from the medical center, from Rex, from other hospitals participating on 12, 13, 14 different work groups, work streams, developing protocols for how we're taking care of COVID patients, policies for how we're utilizing our protective equipment. It's been a great effort. It's great to really see the coordination and the teams come together to respond. It's been impressive.
I completely agree. And we're fortunate with the resources that we have in the Triangle hospitals, and also a lot of the expertise that lies in the university. And so when we're quickly implementing best practices, we're able to share that with our rural hospitals across the state. So I think it's a great way to spread knowledge and expertise to really all communities across the state.
And I'd also say the coordination with the other healthcare systems in the region has been very, very good. We're in constant communication and contact with them. They're sharing information with us. We're sharing information with them. We're planning things together. So that's also been refreshing.
I think it's important that we do. It's important that we do that too, because it by the area health systems working together and making decisions in a collaborative manner, it helps the community hear a consistent message and planning. And I think it's been helpful in reinforcing a lot of the policies. For specifically, I think about the visitor policy. We all moved to that at the same time, and so the community heard the same message at the same time. And I think that's helpful for understanding the changes that we're making, why we're making them.
Can I ask about two other areas in your preparations? We talked about beds, and it sounds like you feel like you've got really pretty good bed capacity right now. How are things in terms of PPE and staffing?
Sure. So go ahead, Ernie, please.
I was going to say with personal protective equipment, early on, that was one of our biggest concerns was making sure that we had enough if we indeed had a surge similar to what's happened in some of the other northeastern cities, and that was a big concern for us. And UNC healthcare systems across the state and the country, the demand for all of those supplies went up dramatically, and so we're all competing for those supplies, and it's been very difficult. And one of our biggest challenges, and Janet and I have many responsibilities, and probably our most important responsibility is to protect our staff and our physicians, make sure that they're safe and that they have the equipment and the supplies to take care of our patients. And our obligation to fulfill that responsibility has been challenged. And our supply chain teams, our purchasers, executives at the highest level of our organization have been working tirelessly to acquire more equipment. And we've been successful. We've been successful through our normal supply chains, through non-traditional supply chains. We've found other sources of FDA-approved equipment. And then the donations that we received from the company. We've received over 1 million items donated that can be used for patient care if and when needed. So we're feeling pretty good about our PPE situation right now. If we do get a massive surge over the next couple of months, we have time now to prep given the trend. So feel much better about it today than we did 6 weeks ago. And in terms of the staffing, we have part of what we've been doing for the past 6 weeks is developing new models of care so that if we are overwhelmed with patients, we can take care of them in a different way than what we've done before, by training some of our med-surg nurses to work in ICUs, some of our physicians, some of our surgeons who are not as busy as they are now to help with ICU care or patient care. So feel pretty good about where the staff is right now. They're comfortable with this team model of taking care of patients and are ready for the surge if needed.
This is Sarah with WRAL. I wanted to just follow up again on my original question about furloughs. I know you said that is not happening right now, but I just wanted to clarify, have any employees been asked to take paid time off or to, take some kind of time off, even if not specifically a furlough?
There have been staff that we have closed clinics. We have closed some different departments, and we've created a labor pool. Right now, we probably have at Rex, we probably have 300 people in a labor pool that we are redeploying to other areas. I mean, we've created new jobs. We have staff at all of our entrances screening everyone that comes into the hospital. We have command centers set up here that we're staffing. So we're able to work some of the staff that have been currently displaced in other areas of the hospital. There are other areas where staff have taken paid time off because of the volume is low. But we do that anyway. It's not unique to this situation.
Yeah. And one thing that we did put in place along those lines for the individuals, for whatever reason, weren't able to be deployed to another area. We wanted to make sure that folks get the wages that they're accustomed to. And so we've advanced, if there's a need for individuals to get an additional PTO, I believe we'll go up to 160 hours right now and reevaluate. So again, our primary concern really is our providers and our workforce. And so we're doing everything that we can to make sure that they not only remain safe in the workplace, but we've got to think about their emotional well-being through this as well. And so advancing PTO was one strategy. We're providing childcare and offering resources there. We've set up food pantries at both of our hospitals to be able to assist in that manner. And so a lot of time and effort is really focusing on workforce wellness. It's a priority for all of us.
We gave all our staff a free roll of toilet paper too.
So we've only got a couple minutes left. And one thing we said we wanted to talk about real briefly from each of you is just sort of how has the epidemic and pandemic affected you and your families personally?
We were just talking about that with the team, and I told them that I was looking for the silver lining in all of this, and I had identified 3 good things, and the first one was no traffic. It's been really nice to drive to the hospital and have 0 traffic. I'm not wearing a tie anymore. For some reason, during a global pandemic, we don't have to wear ties. I don't know why, but that's pretty cool. And then I've been able to spend more time with my teenagers on the weekend that otherwise I wouldn't have because they're stuck at home. So that's been a big positive. And then I mentioned it professionally. What's affected me is that obligation that I mentioned and making sure that we have all of the equipment that we need for our staff, and that's been challenging. And we're working through it, and we'll get what we need for the staff.
And Janet, you?
It's there's been many silver linings, and I think this situation has reinforced why my entire career has been in academic health centers. The collaboration between university and the medical center is tremendous, and the resources that it provides us. The commitment and dedication by our frontline clinicians, it's quite impressive, and it is inspiring. And I will comment too, I have 2 college-aged sons who go to school out of state and have both had to come home as a result of this. And it's been fun spending a little bit more time with them and having them serve as my tech support when I have to do evening calls and so forth on Zoom and WebEx. But it's certainly a lot of good has come from the situation.
Great. Well, thank you so much, both of you, for being with us here today. Again, we are recording, and this will be posted on YouTube for folks if they need to reference some of the responses later on. Thank you again. We'll have another call scheduled on Monday. We're typically doing these on Mondays and Thursdays, and this will conclude our call for today. Thank you.